knock.
Come in.
Hi, my name's Faith. I'm going to be your nurse today. We're going to do your head to toe physical assessment. First, I'm going to go wash my hands and put on my gloves. All right, I'm going to check your wristband. Will you give me your full name and date of birth?
Hayden Clinton J. 6/1894.
Okay, good. First, what I'm going to do is we're going to start with your head, and it already looks midline to your body. I'm going to inspect your scalp, look for any redness, lacerations, lice. Nothing. We're looking good there. And next, I'm going to inspect your face, look for any skin discolorations. If you don't have any, what I'm going to do next is I'm going to feel for your temperature. All right, warm to touch and equal all over. Next, I'm going to palpate your maxillary and frontal sinuses. Tell me if you feel any tenderness at all. Did you feel any tenderness at all? Okay, good. What I'm going to do next is inspect your eyes. I'm going to pull down. Will you look up for me? All right, good. The sclera is white, and there's no signs of jaundice or inflammation or redness. So what I'm going to do next is you're going to look straight ahead, and I'm just going to take my pen light and check your pupillary reflexes. All right, good. I'm going to turn my light off, and you're just going to look straight ahead for me. Follow my pen light. All right, good. Pupils are equal reactive, round, and they accommodate to light. Next, what I'm going to do is I'm going to inspect your nose, and it looks like there's no skin discolorations. I'm going to have you tilt back a little bit your head. I'm going to look on up there in your nostrils. No signs of inflammation or redness. Mucosa is pink. Also, your septum is midline. There's not too much drainage. Next, we're going to do the patency of your nares. Check for that. And what I'm going to do is push on this side and you're going to blow, and I'm going to push on this side and you're going to blow, okay? All right, good. Next, what I'm going to do is I'm going to inspect your mouth. Just keep it closed for me really quick. All right, your lips are symmetrical in shape. They're also pink, and they're not too dry. They're moist. I'm going to have you smile real big for me. Good. Your teeth are white. You have a symmetrical smile, and they're smooth. I'm going to check your inner mucosa. I'm going to pull down your lip. Looking good. Both are pink and very moist. I'm going to look at your buccal membranes. Just open up wide for me. Buccal membranes are pink and moist. Going to look under your tongue, sublingual. Pink and moist, which is good. Stick out your tongue for me. Good. It's more of a light pink and a little bit rough, which is good. Gonna look at your top palate, or your soft palate and your hard palate. Both are pink and moist. Gonna look down at your tonsils. Still are intact. Your pharyngeal area is pink and moist, and uvula is midline. Next, what I'm gonna do is I'm going to check your oracles and the insides of your ears for cerumen, inflammation. All right, no signs of cerumen and inflammation. Next, I'm going to palpate your ears, and you tell me if you feel any tenderness at all. All right, good. Next, what I'm going to do is inspect your neck for any discolorations. You don't have any, no lesions, lacerations. I'm going to check your trachea, make sure it's midline. All right, next I'm going to palpate your thyroid. No signs of any masses. Okay, and next what I'm going to do is palpate your carotid pulse on both sides. There are equal and rate and rhythm. And now what I'm going to do is check for a bruit in your carotid artery. And a bruit is a narrowing of the blood vessels, and it causes like a turbulence in your blood flow, and it sounds like a swishing sound. So I'm going to check for that. All right, good. There's no signs of a brewery at all. So now what I'm going to do is I'm going to inspect your anterior thoracic cavity. Looks like there's no skin discoloration, no visible pulsations. So what I'm going to do is first I'm going to auscultate your lung fields. Just going to have you breathe normally for me, and I'm going to check for any wheezing or crackling, adventitious sounds. Just breathe in normally for me. Alright, good. There was no adventitious sounds, no crackling, and no wheezing. So next what I'm going to do is I'm going to auscultate your heart. Your heart is located in your second intercostal space on the right side and your left intercostal space, the fifth space. So first I'm going to listen to the aortic valve, which is located in the second intercostal space on the right side. Okay, going to listen to your pulmonic valve, which is in your second intercostal space on your left side. Erb's point, which is in your third intercostal space on your right side, or left side. Your tricuspid valve, which is in your fourth intercostal space on your left side. And your mitral valve, which is in your fifth intercostal space on your left side. It's also where I can hear your affable pulse, which I'm also going to auscultate, and it is the maximum point of impulse. Alright, you had a normal rate and rhythm. No signs of dysrhythmias. So next what I'm going to do is I'm going to auscultate the back, your posterior thoracic cavity. So can I have you just turn to the side for me? Awesome. I'm going to inspect your back, look for any lesions, any pulsations, signs of lacerations or anything, which I don't, and your spine is midline. So what I'm going to do is I'm going to auscultate your lungs from behind. Just breathe in and out normally for me. Alright, good. I heard no signs of crackling or wheezing, no adventitious sounds. And next what I'm going to have you do is breathe in very deep and breathe out. And breathe out. Alright, very good. Checking your lung capacity. Alright, I'm going to have you turn back around for me. And what I'm going to have you do is I'm going to check your abdomen, check for any signs of discoloration, any visible pulsations, and I don't see any. And what I'm going to do is I'm going to auscultate all four quadrants of your abdomen, listening for any hyperactive sounds, any adventitious sounds that shouldn't normally be there. And what I should hear is just a normal gurgling sound. First, I'm auscultating the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Alright, there was no hyperactive vowel sounds at all. No underactive vowel sounds. And what I'm going to do next is I'm going to actually palpate your abdomen for you. You're going to tell me if you feel any tenderness at all, okay? I'll get on this side. First, I'm going to palpate your right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I didn't feel any masses. Did you feel any tenderness at all? I'm going to give you some education for a breast examination. Have you ever examined your breasts before? Okay, well, it's good to do it once a month, usually at the beginning of the month. And yes, since you are a male, you still can have issues with that, have cyst cancer in your breast. So what you're going to do is in front of the mirror or in the shower or when you're laying down on your bed under a pillow, you're going to put your hand up behind your arm for me. You're going to start up at the base of your armpit, push in a little hard, and you're going to make circular motions down to your breast and up around your breast. And just keep going around your breast, around and around until you reach your nipple. Go over your nipple, and then you squeeze your nipple. Make sure there's no discharge that comes out. If you feel any abnormalities, any small masses, big masses, if anything comes out of the nipple, you need to contact your doctor immediately, and then do the same with the left side, and at least check that once a month. Next, what I'm going to do is check your upper extremities. Let me see here. No skin discolorations, no lacerations or anything. Your skin is warm to touch. I'm going to also check your skin turgor. All right. I'm also going to do this side. No skin discolorations. Check your temperature. Temperature is warm to touch bilaterally on each side. No skin turgor. Good. I'm going to check your capillary refill on both hands. Nails are round and clear. No signs of clubbing. Next, I'm going to listen to each brachial pulse. All right, good. They're both equal in rate and rhythm. I'm going to listen to both radial pulses. Both equal in rate and rhythm. So now what I'm going to do is I'm going to test your strength. Will you push up on my hands for me? Push down on my hands for me. Okay, and now we're going to check your range of motion. Will you flex for me? Extend for me. And you're going to abduct. Just bring your hands up together and adduct. All right, good. Did you feel any discomfort while you did that? Okay, so next what I'm going to do is I'm going to check on your lower extremities. We're going to check for any skin discolorations. No skin discolorations. Your skin is warm to touch bilaterally on each side. I'm going to check for edema for capillary refill on both sides. All right, we're looking good. Now I'm going to check your dorsalis pedis pulse on both feet. There we go. And then your posterior tibial on both feet. All right, good. I'm also going to test your strength. Will you push up for me? Push up for me. And push down for me. Okay, good. And next we're going to check your range of motion. Will you extend your legs out for me? And then flex in. And then I'm going to have you stand up really quick, and then I'm going to have you abduct out, adduct, and then do the other leg. All right, and you can sit down. I'm going to do your call light just in case you need anything. Make sure you have everything at your bedside table. And if you need anything, just call me. Do you need anything right now?
No, ma'am.
All right, well, here's your call light, and I'm going to go wash my hands and chart. Thank you.